Okay. Hello. We are going to be discussing evidence-based practice for the physical therapist assistant. And this is going to be occurring instead of our normal meeting time on Thursday, November 12th lecture, in case we run over with the CVA practical checkoff. So I had put this together a few years back. This is kind of a vision of mine for the program that our students are graduating with an understanding of how evidence-based practice works, and the fact that I strongly believe that the PTA has a seat at that table with our DPTs. And so I gathered some information from the American Physical Therapy Association for presenting this material to you today. So our objectives are to identify the components of evidence-based physical therapy practice, to employ search strategies with available resources to locate relevant research, to discuss the basics of study design, outcome measures, results and conclusions of research studies, and to describe the application of evidence-based practice and how it may impact the management of our physical therapy patients. So as far as the value of evidence-based practice in physical therapy, it is one of the 6 themes of the APTA vision, the 2020 statement. It really is a requirement for demonstrating ethical practice. You do not want to be utilizing old practices when there could be new interventions that are better, and it can also improve your impact and your effectiveness as a clinician if you know what the latest research is saying. So by definition, evidence-based practice is the integration of the best clinically relevant research with clinical expertise and patient values. So there are times that research may not even be available for that particular type of patient that you're treating. But even if it was, it may not align with the patient's values. And then, of course, it also has to be something that you as the clinician with your expertise and your skill is able to carry forth. So it very much is this triangle of different concepts that need to come together. And we're not just going to leave one of those components out. But this is the truest definition of what evidence-based practice entails. And so we want to use the best available research that we can access, that is out there. So this is not about doing Google searches. Google is obviously very good for some things. And I know all of us, it's very easy just to Google something and find information. But what we are talking about here is not using Google as a primary means of obtaining evidence. We want to use and find research from peer-reviewed sources. And so, you always want to take into the account of the quality of the information. So publications like the American Physical Therapy Association Journal are very good. They are, when something is written, it is also looked at by other sources and other peers before it's published. And so that's the kind of research that we want. Obviously, research is going to constantly be changing, and so that's our means of staying current in the field. If you find yourself that you're using the same techniques year after year after year, even within a couple of years, you really need to self-assess what you're doing and, figure out if there's other ways, if there's newer evidence, if there's newer, better ways to provide intervention for our patients. But we do know that there are barriers to utilizing evidence-based practice. The APTA did a survey, and these were the barriers that they found: that clinicians were running short on time to actually look and find research, that once again, there may not be any research that's available. It may not be easy to access. That seems difficult with the technology that we have today. However, there are portions of the country that still have, slow internet and maybe lack of internet access to look for and search for articles. And again, the time to actually learn about it and how to apply it. So this, the whole part about this is just giving you another tool that I think is probably the most important as you leave here to stay current in the field. And how is it that you can, find articles, interpret them a little bit, and then integrate what you're finding from that article into your practice. So how is it that you're going to go about finding the best available evidence? Well, first you have to form what's called, I'm not really sure how to say this, a PICO or a PICO question, a PICO question. And for our assignment, I'm actually going to give each of you a different PICO question that has already been formulated for you. But I will discuss how that process takes place so that when you want to research something else, that you will know how to do this. We're going to be accessing research sources. We're going to use certain search techniques based off of the PICO question. And then we are going to look at the literature and look at how the research was designed and the methods that were used to answer your clinical question. So as far as formulating a clinical question by using the PICO model, the P stands for patient or population, I stands for the intervention or interventions that were compared in the study, C is the comparison of the interventions, and then O is the outcome. So it's a way of using foreground information from what's happening in the clinic with your patient, so their diagnosis. And then the focus for the PTA is going to be on looking at and comparing interventions that are within the realm of the plan of care. For example, if the plan of care would say something like, maybe we had a low back pain patient, and the plan of care simply included therapeutic exercise. Well, what we're going to do here is we're going to have you compare different exercise approaches to see which one had the better outcome for that particular patient. So it may be something like a patient with low back pain was McKenzie exercises, were those more effective at reducing pain versus, say, just general low back strengthening exercises? So formulating the question, an example here is in patients with complete cervical spinal cord injury who have shoulder weakness, that's the patient type, would adding electrical stimulation, first intervention, when compared with resistive exercises, second intervention, so now we can get a comparison between those two things, was strength increased needed for transfers. So that is the outcome. So you're going to come up with your PICO question. And again, I'm going to issue you a PICO question for you to build off of for your assessment. But if you want to do this in the clinic, then this is how you're going to formulate your own question. And then you're going to simply break down the components of the question, and those will be used for search terms. So you will be able to research your question from the VU database. I used all of the VU databases for my doctorate studies and had no problems whatsoever. So this is a fairly simple assignment. I'm confident that what you can access through your MyVU account through the library will be exact. You should not have any trouble finding evidence. And you have tremendous access to a lot of different articles. But some of these search sources are available, and this is probably not even an inclusive list. PubMed, Medline, CINAHL, ProQuest. ProQuest is the one that I've used a lot with my doctorate studies. You've got the Cochrane databases for systemic reviews, and then you also have access to the American Physical Therapy journals. Even without being a member, we have purchased access through the university for you to have access to those. So if it's been a while that you have done any research, I know you've done this as part of your studies for English Composition 102. If you have particular questions about the databases, I would encourage you to contact Megan from the library. She will even work one-on-one with you if you want to go over there, if you're having difficulty. But what you're going to want to do is to access any one of those databases. So like I said, I've used ProQuest a lot. Then you're going to use something called the Boolean operators to connect the words to narrow down your search. And that's essentially what the PICO question is going to do for you, because you wouldn't want to just do a basic search, say for CVA or Parkinson's or low back pain or whatever it is, because you would get way too many. You would get thousands and thousands of hits on your research, and you really want to narrow it down to where maybe you only get 20 or 30 articles to look at to see, if any of them have what you need. So when you're searching, what I usually do is once I get to the database that I'm going to use, I use the advanced search, and I link those particular search terms from my PICO question and just put them into the search box. So you can use quotations around words, and that will link words together. So our example here is physical therapy within quotes, so that everything that entails those two terms is going to be always linked together. And then you can either use and or not, depending on how broad you want your search to be. Honestly, I usually use and. So for example, I might use physical therapy and back pain and therapeutic exercise to pull up, and that will pull up as many articles that have all three of those components within them. So if you use the word and, that will find articles that contain all of the search terms. So arthritis and practice guidelines. If you use the word or, that is going to include either topic, articles about either topic, arthritis or practice guidelines. That's why I tend to use and. If you use the word not in your search, then that will exclude certain things that you label as you want to be excluded. So it excludes all articles about arthritis that contain or that do not contain practice guidelines. So like I said, my biggest go-to is usually the and option. So keyword and searching, it depends on how you search what you're going to get, obviously. That's why it's important that you want your keywords to be, fairly narrow, but then again, if you go too narrow, you're not going to find anything. So you want them broad enough that you're going to get hits, but not too broad that you're going to get thousands of hits. And so that's why the and portion of the Boolean operators really works well with the advanced searching. Like I said, if I can find 20 to 30 articles that are giving me information about that, then I can more easily go through those to find two that are going to be beneficial for me. So creating search strings using Pico questions, it goes like this. Again, the patient is what stands for the P. The intervention is the I, the C is the comparison, the O is the outcome. So when treating patients who have ankle fractures, that's your patient type. Would adding early weight-bearing exercises to a therapy regime increase range of motion faster than immobilizing? So our patient population type here is ankle and fracture, or if you wanted to just do ankle fracture in quotes, that would be fine. The intervention are early weight-bearing exercises. The comparison is immobilization, and then the outcome is range of motion. So then you just string those components together and put them into your advanced search. So ankle fractures and early weight bearing. If you don't have, oftentimes you'll only have 3 bars for an advanced search or 3 lines. So you may have to, cut that down, weight bearing exercises first, and then range of motion, and then maybe do another search for the ones with the immobilization. So anything that you're going to find in the article that compares those two things is what I want you to do for this particular assignment. So as far as the description of evidence, we find the hierarchy. There's a hierarchy of evidence, and you will note at the bottom of the hierarchy, meaning the lowest level of evidence, are expert opinions. So, just because someone has done that in the clinic for years and years, and that's their experience, yes, that may work, but it may not work overall, and it may not be supported by the evidence anymore. So ideas, expert opinions, the way that we've always done things, is the lowest form of evidence. Then we come up with case reports. These are different types of just case, actually looking at what we did with a certain patient and what their particular outcome was. Case control studies is a little bit of a more advanced form of research. And each of the articles that you find there, you will know exactly where on this chain, because the description of the report will include these things. So it'll say if it's a case report, it'll say if it's a case study, it'll say if it's a randomized control trial, or if it's a systemic review or meta-analysis. So by the time we get to randomized control trials, really case reports and case studies are usually just looking at what a patient, or in the case control studies, a group of patients, what kind of interventions they had, and just essentially documenting what happened. But the randomized control trials that's really the highest form of evidence for just one research study. And what this means is that there's going to be a control group. So one group within this research design got the intervention or the treatment that we're trying to figure out if it's beneficial. The other group did not get anything. So if it's a true control group, the control group will not receive any intervention. And so that's what sometimes we refer to it as a sham treatment. So in the case of physical therapy, it would be something like maybe we're looking at the effects of electrical stim on how well a wound heals. And so we had one group that would be getting the e-stim as a treatment over their wounds, and the other would be a sham treatment to where the therapist involved in the research study would actually be applying electrodes to the control group, but they would not be turning the machine on. That's what that would be called, a sham treatment. If you're looking at it, in medicine, for pharmaceutical, say, it might be that this, whatever the population is, the patients with low back pain got this particular drug to see if it decreased their back pain. And then we would compare it to the control group who did not get anything, or maybe they got a sugar pill or some type of placebo. So the randomized control trials for one research study is the highest form of research because we can completely compare one intervention to a group that did not receive anything. The problem that we see in physical therapy when we do research designs is it's generally not ethical to not treat somebody. So let's say that we were looking at different interventions for the treatment of stroke. Well, it's not really societally accepted for us not to treat a stroke patient with any type of intervention. And so what you're going to see a lot of times in the physical therapy research because of that is that one group is going to get, say, um, body support treadmill as their intervention, while the other group is going to get more traditional, just exercises and gait training. And then we're going to compare those interventions. So that is one of the drawbacks in physical therapy, is that for ethical reasons and for societal reasons, we are not going to just withhold treatment from someone. We want to at least give them some kind of an option. Now, usually as part of a research design, as an incentive for the two groups, after the end of the research, if it has found to be effective for whichever group, then the opposite group is offered what was found to be effective after they've participated. So that does provide some motivation for patients to participate in research studies. And then systemic reviews and meta-analysis. This is taking multiple randomized control trials and having an expert to sort of consolidate and combine those findings. So if you can find a systemic review on whatever you're looking at, that's even better, because instead of just one randomized control trial, they've actually, maybe there's 20 or 30 or 50 or 1,000 that has been analyzed and put into a systemic review. So whenever you begin to find your articles, you're going to look for two articles. These are the components that you will see listed in the research. You're going to see the purpose of the study, and that's going to be, it literally will be listed at the top of the study. You're going to, the research, the authors are going to identify the the groups that they used for comparison. So it may say, 49 females from the ages of 20 to 40 with cervical pain were divided into two groups, or whatever it was. The independent variable and the dependent variable, these are literally listed in the title of the article. So the independent variable is the presumed cause of the measured effect. So what it is that we're trying to see if it affected. And it's one variable that is manipulated by the researcher. The dependent variable is measured, the measured variable used to determine the effects of the independent variable. Then the research study will list the inclusion criteria or the characteristics that they allowed for participants to come into the study with. So this will be things like patients with herniated discs, but without, maybe they would leave out anybody who had, or I'm sorry, that's going to be your exclusion characteristics. Your inclusion characteristics are usually going to be, male or female, gender, age specifications, what sorts of diagnosis were permitted for these patients to come and participate in the study. Exclusion criteria would be those patient types that were eliminated. So maybe somebody with low back pain who also had, cardiac problems. The cardiac issue would be the exclusion criteria. And that will be listed. All of these things are very clearly listed in the articles that you're going to find. Ethical considerations, at a minimum, there needs to be informed consent, and there will be. Patients have to, sign off on this, that they understand the risk, the benefits, the purpose of the study, what kinds of treatments they're going to be getting. So that will be listed somewhere in the article, how patients were informed, and then they gave consent for the researchers to go ahead and work with them. And then the components of the research study, the data analysis, this is very complicated. These are your statistical methods used to determine if there was a significant difference between the two groups. When I did my doctoral studies, we had to analyze all this stuff, and it's very complex, and I don't want to get into that. You're not going to be learning how that happens. It's kind of beyond the scope of PTA in this course, but I just want you to look for that as part of your with what is in your article. And some of the examples are the ANOVA, the chi-square, the independent t-test, the Mann-Whitney. So if you see these terms, this is just the way that the authors of the research study how they ran their statistics. And then there will clearly be the results and conclusions. Let's be honest, we all tend to go down to the results and conclusions because there's, it's kind of the hard and fast of what happened in the study. And then a good research study will also contain the limitations of the study. So, no research design is perfect, no research study is perfect, but this might be things like, 5 out of the 20 participants dropped out of the study because of whatever, they became ill or they moved or whatever. Maybe there was something that happened with the equipment that wasn't expected, or maybe as they were studying this particular situation, something happened and they realized, oh, I could improve on that if I did the study the next time. So a good research study will always list its limitations. I would immediately raise my eyebrows if the authors complain that there were no limitations or that those were not identified, because as much as we're trying to put this in a lab and really control it and watch the effects, we are dealing with human beings, and there's lots of things that can happen that we didn't expect. So there are ways of summarizing the evidence, and really when you get out into the field, you're going to want things that maybe have already been appraised by an expert. And I know like ProRehab is a great company who they actually have people employed by them who are actual researchers, or they've conducted research and they also appraise. They go look for articles, they appraise them to see if this is good information, and then they pass it down to their employees. That really is one of the best groups, and the way they do that I've seen around. But you can find things, critically appraised topics called CATs, where someone has already looked at the question, they've looked at the bottom line of the evidence, they've summarized it, they've made their comments, and so on. And the APTA used to have something called Hooked on Evidence, which was just sort of a quick way to find, things that you were maybe looking for. So, you should be able to find some of these types of things that are already done, so that you're not going through this process that I'm having you go through. But translating evidence into clinical practice, it's very, like I said, in the research lab, things are trying to be controlled. They are, very specific. And as we know, in the physical therapy clinic, that's not always how things go. So we want to look for evidence, and we want to see how can we take what we found in the lab and actually convert it into the clinic. So when you become an APTA member, you will have access to the peer-reviewed journal that they put out each month. And they've actually put little links into their articles that kind of give the clinician a very practical way of implementing what was found in the research. So linking the evidence in practice demonstrates application of evidence from systemic reviews into practice, maybe with some tips on how to do that. The bottom line they'll list out are the clinical summaries that they are translating, that are ways that clinicians can take that information and put it into play. And then evidence in practice is used to illustrate how the evidence is gathered and how it can be used in clinical decision making. So you will have access to the APTA journals right now as part of being a student in the PTA program through our databases. But once you graduate, I would highly recommend that you become an APTA member so that you can have access to the journal that they put out each month. Final thoughts, as far as incorporating other components of evidence-based practice, you have to consider your clinical expertise. There, for example, if the research states that a certified NDT therapist is getting better outcomes than someone who isn't, well then, that's suggesting that you need to get your certification in that particular technique if you want to be, if you want to be able to use the research that supports that. You do have to take into patient values and their circumstances. The biggest example I can think of as far as a medical type example here is that, and I wasn't aware of this until I began to practice in physical therapy, but there is a religion that they do not believe in blood transfusions. And so there may be a medical situation where the doctors would say the patient needs a blood transfusion. That's been shown in the evidence to be the best way to treat this particular condition. but the patient's values and religious beliefs will not allow for that. So that would be off the table for them, and we'd have to find, you know, an alternative. And then, of course, utilizing the best applicable research. So research is always changing. You really want something that is, you know, within 5 years, if you can find it. But the fact is that there are things that are older in the literature than that. So you're just going to find the best possible research that you can. So here's my bibliography, and then what I'm going to have you do is an assignment. So I'm going to issue you a PICO question that will help you formulate your search, your advanced search from, so that you can find a couple of articles. And then the rubric is pretty straightforward. I'm just going to have you compare two articles, and you're going to list out, you know, all the components of the articles, the conclusion. I'm going to give you a little bit of a scenario, a patient scenario with a plan of care. And I'm going to have you, you know, summarize what you found from your two articles. So I'll be giving that rubric and that assignment, and I'll probably have that be due sometime during finals week.